Hi, my name is Tiffany Fazon, and I'm PoCoG's Executive Officer. And today I'm joined by Dr. Jennifer Ong, who is also a concept author at our recent concept development workshop, to share her experience of the day.
Thanks for having me.
No, thank you for being here with us. So, could you tell us a little bit about yourself?
So I am from the University of Sydney at the Faculty of Medicine and Health. I teach and do a little bit of research at the Sydney Pharmacy School. Um, and my research interest and I guess teaching experience is in palliative care.
So, how did that spark your interest in psycho-oncology?
So I suppose having a background in pharmacy, I'm a registered pharmacist by trade. A lot of the focus is generally on the medications, which makes a lot of sense. But we did do a exploratory study of our pharmacy students who were being delivered a palliative care, I guess, component or topic of our cancer course. And they rated themselves very knowledgeable, very confident, and very prepared to discuss medications like opioid tapering, side effects. But one of the other items that we did survey them on was, how comfortable do you feel discussing um, other matters related to dying with patients who have a life-limiting illness, or discussing these matters with carers of a person with a life-limiting illness. And I suppose not surprisingly, it was less than moderately prepared, less than moderately confident, and it makes a whole world of sense because there isn't a great deal of focus on other aspects of a person's care at end of life. So that's what piqued my interest in terms of it's just greater emphasis to look at at a whole person, at a person as a whole person. And so with the introduction of voluntary assisted dying in New South Wales, one of the last states to do it, um, patient dignity did play a lot on my mind. I was very curious as to, how much of an effect dignity has on a person's decision to request for VAD. But I am aware that loss of dignity does play a huge role in this decision. And I just wanted to see what, the medications were doing to a person's dignity.
Yeah.
And so, yeah, we considered looking at how it affects a person's performance status and ability to um, carry out, activities of daily living independently as a surrogate for, how it might impact a person's dignity.
Yeah, so it's really about taking that holistic approach and kind of also considering things like quality of life and dignity that's really important to you. Yeah.
Exactly. So that's how I've ended up here. Not a great deal of experience with, I guess, the psychosocial side of things. And I understand that, dignity would fall under that category as well.
So I kind of wanted to shift a little bit to focus on the concept development workshop. You mentioned a little bit about your concept, but I'd love for you to kind of give an overview of the concept that you presented on the day.
Yeah. In a nutshell, we just wanted to see how um, what pharmacists were doing that may impact a person's sense of dignity. The problem is, I suppose, indicators and measures of dignity aren't routinely um, assessed in the setting that we're undertaking the work. And so that's why we've decided to use performance status. And it's a very blunt, it's a very blunt tool. We have landed with that because I suppose in a sort of common sensey kind of way, if a person is unable to, independently bathe themselves, independently, get themselves to the toilet, independently, do what they need to do on the toilet, and dress themselves and just, undertake, some basic life tasks. you can imagine that it has a great potential to significantly impact a person's sense of dignity.
Yeah.
Yeah, and so that's what we're hoping to do, to just review medications that we know are futile, especially in an end of life setting, and just to see what sort of impacts it has on a person's performance status.
Yeah, that sounds really interesting. So how was your experience on the day presenting that concept?
It was, I felt like, to be entirely honest, I felt incredibly privileged. There was so many brains and so much expertise, and so much experience from a wide variety of, I suppose, panel members and attendees. So I I remember feeling incredibly lucky and incredibly privileged, to be able to, get a little bit of everybody's time. Another thing that stuck out for me was how incredibly friendly and constructive the feedback was. Everybody was genuinely interested in designing the best project possible.
Yeah,
So I thought it was a marvelous day and a marvelous experience.
that's really great to hear that feedback. I'm glad you had such a positive experience of the day. That's really what we're aiming to do with this kind of days, bring different people with different expertise together, to kind of help develop your concepts. And on that, how did this help you to develop your concepts?
I suppose I signed up. I was a little bit hesitant to submit something because obviously I'm not a psychologist. I have uh, no psychological background in terms of expertise, and so I was a bit hesitant. But I think once you sort of get over that and have a think about why you're doing this, and it really was so that I could, um, I can't see my own blind spot, and so by presenting it to PoCoG, I was hoping that um, attendees and panel members could see things that I obviously don't think about and missed. And so I feel like it improved our our I guess our concept in that we considered additional outcomes that I hadn't originally considered. And it gave me ideas of, where we might be able to take the work after the present project is completed. It was, yeah, I think walking away from the day, obviously, the hard tangibles that you take away is, a seriously improved concept, but also the feelings of being really well supported, and excited and reinvigorated by the excitement of the attendees and the panel members. So it's sort of it's a push in the right direction, and it's reassuring. I walked away feeling very supported and reassured.
Right. And before we wrap up, so we briefly touched on this before, but what would you tell anyone out there who's still kind of hesitant or thinking about, they might have a concept that they want to present, but they might be feeling like you, don't know if this is the right avenue for me. What would you tell them?
I would say just do it. But it is, after going through the entire process, it really is meaningful, especially if you're hoping to get a little bit of feedback that's constructive. And PoCoG's the entire day, all the attendees were just so supportive. It was such a positive environment. So yeah, there is a lot to get out of it, tangibly, but also that reassurance, yeah, from others that do think differently from people within your own discipline.
It's really kind of highlighting the fact that any PoCoG member could present a concept and should present concept at the concept development workshop if they're, kind of thinking about it?
I think if you're thinking about doing it, just do it. And we'll just see what comes out of the wash.
On that note, we'll wrap that up. Thank you so much, Jen. It's been a great chat with you today, and hearing about your experience of the concept development workshop as well.
So much, Tiffany. It's been such a pleasure, and thank you again for the opportunity to present.